patients often ask me, how can I avoid tearing with my delivery? And I tell them that there are things that we can do to help minimise the chances of that happening. There is a device that they can buy antenatally and use called an epidural, and certainly there's been some studies which have shown that can be of benefit to help minimise the likelihood of perineal trauma with childbirth. When it comes to childbirth itself, it depends really on the elasticity of their tissues, the size of the baby, whether or not they need an operative vaginal delivery, and how controlled they are with pushing the baby out with that, at that critical time with the delivery. If their tissues don't have a lot of elasticity, then obviously that increases the likelihood of tearing. Now, from my experience, I would prefer, obviously, no stitches. That's the first goal. Next goal is maybe a small tear. Third goal, I prefer to have an episiotomy rather than a nasty tear. By nasty, I mean a nasty second degree, or even more third degree, or even worse, fourth degree tear. So if it's likely to be a nasty tear, I prefer to do an episiotomy first, because it heals better, and the long term gives them a much better result. At the time of the delivery, the most important is a slow, controlled delivery of the baby's head to allow gradual stretching of the perineum. If that can be achieved, then that reduces the likelihood of perineal trauma considerably. So we put a lot of effort into gradually delivering the baby's head and guarding the perineum, as we say, to help minimise the likelihood of perineal trauma. I tell patients, in my experience, there's a greater likelihood of less perineal trauma with an epidural, because with an epidural she doesn't have that incredible urge to push uncontrollably when delivering the baby. We can have a much more slower, controlled delivery of the baby's head. So certainly I find that the perineal trauma is less likely with an epidural block rather than without. Now, that's not the reason why women should have an epidural, but certainly an epidural can help to minimise the likelihood of having nasty perineal tearing. And I think if the accoucheur or the obstetrician takes care then with suturing, then that will optimise the healing. Suturing's got to be done carefully in correct layers, and so women tend to have an excellent recovery from that. So when I check the perineum at the 6 weeks postnatal visit, it's healed beautifully, and quite often you can't tell there's been any perineal trauma whatsoever. So it's certainly one thing that we check at the 6 week postnatal visit. That's one reason why that postnatal visit is important. But for the large majority of ladies, they heal fully, and and they can go on and have other babies successfully.